Hello, my name is Shayla Perez, and I will be doing a presentation on an orchiectomy. I'll share my screen. Okay, so an orchiectomy, it's a surgical removal of the testes. Why would an animal need this surgery? It is a preventative surgery, so it prevents things like testicular cancer and prostate disease. It also has physical and behavioral benefits. It eliminates roaming, leg lifting, and mounting. So like trying to, find a mate. There is few risks since it is such a common procedure amongst pets, and it can be way more cost effective than having to deal with other health problems that could have been prevented. Is it a common or rare surgery? It is the most common surgery as stated with male pets. 80% of dog owners and 85% of cat owners in the United States neuter their pets. There is no diagnosis needed, just a pre-anesthetic checklist needs to be filled out before to determine that the pet is healthy enough for anesthesia. Can the surgery be prevented? Is the surgery elective? It is elective, but it is highly recommended. Pet owners can be seen as irresponsible if it is not done due to the overpopulation in shelters and on the streets, strays. It can be performed at an early age as well. Cats can be neutered as early as 6 to 8 weeks and dogs at 8 weeks. But it's best if it's done around the 6 to 9 month age range. Some possible complications of the surgery. There are complications, however, the benefits highly outweigh the risks, and it has a very low mortality rate with only 0.11 of neuters being fatal, having complications that make them fatal, so less than 1%, and only 2.1% experience other type of complications. Now, this is mainly due to the inherent risks that come with anesthesia itself. Now, there are risks putting a pet under. However, the benefits highly outweigh that, and most of the risks are post-surgical. So, infection, wound dehiscence, and post-surgical complications. Is this a one-time surgery or does it need to be repeated? The good thing about a neuter, it only needs to be done once, and it needs to be done once, and the surgery site is tattooed so that any other veterinarians that suspect the testes are intact can know that this process has been done and does not need to be repeated. So the surgical procedure, first we prep the patient and then we clip the hair around the testes, not necessarily too clean, just to have an aseptic area using aseptic technique. The testicles are incised and the internal testes are removed. The spermatic cord is ligated and replaced deep into the testicle. And once that is successfully ligated and placed, the dartos fascia is sutured and the suture is inverted. It just makes it the healing process easier. The instruments used during this procedure, I have them here: surgical drapes, 4-hug towels, backhouse towel clamps, Mayo scissors, a 4x4 gauze, a little stack of the gauzes, Rochester Karma or mosquito hemostats, Olsen Heger needle drivers, brown Essence forceps, and a 10 or 15 surgical blade. Will the patient need to be hospitalized for more than 1 day? The good thing about neuters, again, is it's a very quick procedure. The patient can be dropped off in the morning and picked up in the afternoon or same evening of that day. And hospitalization is not necessary, only during the procedure. So our role as veterinary assistants in helping treat this animal is to monitor the patient before, during, and after anesthesia. and we want to make sure they are healthy even before anesthesia. Want to make sure they are healthy enough to be induced, and then explain the aftercare to the client. Make sure they're not allowing them to lick the area or keeping an eye on the area basically, and then prepping them for the procedure. So clipping and cleaning the area before it is surgically, before we surgically incise, and making sure everything is aseptic. Special considerations for the client. So I would advise the client to isolate from other pets, to keep the e-collar on for at least 10 days to prevent any wound dehiscence or any infection. Minimize physical activity, since that could also open up the sutures. Any strong physical activity could disrupt that site. And then just monitor, keep an eye on the incision site for post-operative complications. And will the patient need any follow-up care? So only if there are signs of infection or wound dehiscence, as seen here. We have some infected sutures, and this is the only reason why the pet would come back for a follow-up exam after a neuter. I would educate the owner that this is a very beneficial procedure to any patient, any male patient. It prevents testicular cancer, prostate disease, and it eliminates aggression in some patients. There is an inherent risk of anesthesia, so you want to get that out of the way first. However, there is more pros than cons with this surgery. And obviously the before and after care is very important to explain, since they will be in their hands after we're done. Thank you for watching my presentation, and I hope you enjoyed it.